It is Health Diary. Thank you for joining us. My name is Gladys Gashanja, and today we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, I can tell you this from experience, pregnancy is not a walk in the park. It is such a moving target, especially considering the many changes happening to the body of a pregnant mother. Preeclampsia is such a huge threat to both mother and child, and it's actually been listed as one of the top causes of maternal death worldwide. But good news is that if it's caught early, it can be treated and managed enough for mother and child to live to tell their story. So today we shed more light on preeclampsia, starting off with this fact of the matter. Preeclampsia is a pregnancy complication characterized by high blood pressure. It usually commences after 20 weeks of pregnancy in a woman whose blood pressure had been normal. Preeclampsia develops only as a complication of pregnancy. It can sometimes develop without any symptoms, leading to delayed intervention. Left untreated, preeclampsia can lead to serious and/or fatal complications for both mother and baby.
I'm a mother of one. I was diagnosed with preeclampsia at 20 weeks of pregnancy. My pressure was pretty high. My body was swollen beyond recognition. I could barely open my eyes. I had tanginess around my fingers. When I could touch something, I could feel pain. And then I had reduced bowel movement, like urines were not there at all. Pressure, so I was put in HDU, and I had the Doppler for checking the baby's blood pressure just in case, the baby's heartbeat, just in case it was not there. Then I was given steroids to help the baby develop lungs, and I was also put on magnesium just to avoid any seizures and stuff. Then when they noticed that I didn't show the many symptoms, I was first discharged and went home. But when I went back for my review, my pressure was at about 183 in the systolic, and I think 140 something in the diastolic, so it was pretty high. So when I went to the second facility, they told me, we cannot let you go home, your pressure is high, your child is not growing. He's supposed to be 1.3 kg and he's now at 800 grams. So I went to the theater because the baby was in breech position, and I delivered prematurely at 27 weeks. Initially, I didn't know much about preeclampsia. It's something that had just gotten me by shock. And then there were no support groups that had maybe Kenyans, people who you could do a one-to-one like. So most of the support groups were based outside the country. So I just went through it alone. Then as I was going by the groups, I met a group called Zorinzelani. It's about a child who was delivered through preeclampsia. So I joined Zorinzelani and Pre-Love. There I got the support, but it was quite a devastating moment because when my son was delivered on that Tuesday, there were other babies in the NICU. And that week, from Tuesday to the next Tuesday, all babies passed. So it's quite a traumatizing experience. I feel like maybe if we had some awareness, maybe if I would have known, it wouldn't have been that traumatic for me. I thank God because after we left the NICU to date, my baby has never gone back. My baby has been okay, no complication, no diseases, not even a flu. I used to get very high nose bleeding because of the pressure, and I will Google and it will tell me that's okay, it happens in 20% of the women. We should do more consultations apart from the Google consultations.
Today we cater for our pregnant mothers. The conversation is preeclampsia. To help us understand better, Dr. Felix Oindi, who is an obstetrician and gynecologist at the Aga Khan University Hospital, and of course Ashley Muteti, who is a preeclampsia survivor and also the executive director of the Zorinzelani Foundation. Thank you for making time. And Daktari, definitely starting off with you. I mean, a pregnancy complication characterized by high blood pressure. First of all, What causes some women to get hypertension during pregnancy?
Hypertension in pregnancy is actually one of the complications that are very difficult to predict. And it's generally worse when it starts after 20 weeks of pregnancy, and that is what we call preeclampsia. Risk factors for this is if someone has had it before. If you've had 1 or 2 episodes before, then the chance of it coming back again is a lot higher. First-time mothers tend to have it more than those who've had other pregnancies. Those who are carrying multiple pregnancy, twins, triplets, and other higher orders are at a higher risk as well. Women who are at extremes of age, below 19 years of age and above 40, are also at increased risk. Those who've had a very long inter-pregnancy interval, which we say more than 10 years, are at increased risk. Those who have been in a relationship for a short time or who have a new partner, they tend to be at a slightly increased risk. It's thought because they had less exposure to the male genes. So the male eggs, when they go to the lady will generally form some reaction to them. And the longer you formed that, the less you're going to react to them when you get pregnant. And those who have what we call assisted reproductive techniques like IVF, egg donors, they tend to be at a higher risk. And lastly is those who have pre-existing medical conditions, things like diabetes, pre-existing high blood pressure, systemic lupus erythematosus, what is called SLE, and chronic kidney disease. But that said, most women don't have any of those risk factors. They just appear, and we actually find during routine checkups they have elevated blood pressure.
Okay, so at what point during the gestation period does it actually occur?
There are those women who are hypertensive before pregnancy, and they continue being hypertensive through the pregnancy. So we call them chronic hypertensives. And there are those who are normotensive, which means they had normal blood pressure before the pregnancy. And mostly they have normal blood pressure up to 20 weeks. Then after 20 weeks, the blood pressure starts to go up. Now, those are the ones we classify as having either preeclampsia, if it is associated with passage of proteins in urine or some elements of injury to organs like kidney and liver. And if it doesn't have that, it's just called gestational hypertension.
Okay, so for you, Ashley, what's your story with preeclampsia?
I've had preeclampsia twice in my first and second pregnancy. So in my first pregnancy, it started after around 26 weeks. I started swelling, and I didn't know, I just thought it's normal pregnancy symptoms, you know, the way you feel like you're swelling and things like that. You have a slight headache, so you just associate it to pregnancy symptoms. But after going to hospital now, I was being told that my BP is very high. I went to one hospital, the local hospital. They told me they want to deliver my baby, so I was like, I can't deliver right now. I mean, I'm only 6 months, yeah. So I went to another hospital, and I was now admitted. I got admitted for a whole month. I stayed in hospital when they were monitoring me, and when the pressures were very bad, they decided to remove the baby at 30 weeks. So I delivered 30 weeks, a baby weighing 1.2 kgs. The baby stayed in the neonatal intensive care unit for 2 months, and unfortunately she lost the battle due to prematurity-associated condition called NEC. So that's Zuri. That's why the foundation is called Zuri, in honor of her passing. And then immediately after that, I did everything to ensure that I wouldn't get pregnant. In fact, even my doctors were like, you don't need to get pregnant anytime soon, so let's do all the necessary measures to ensure that you won't get pregnant. But I got pregnant on an IUD. And that was like 3 months after the loss of my baby. So we had options either to terminate the pregnancy or to continue as a high-risk patient. So because of the loss of the child and then terminating another pregnancy, I was like, it's emotionally draining. So let me just see how far we'll get to this pregnancy. The moment I got pregnant, the pressure had already started. So at 30 weeks, the doctor discovered that my baby had stopped growing at 26 weeks. So he was like, now we are preparing you for delivery. Yeah. So when they were preparing me for delivery, they gave me the jabs to mature the lungs of the baby. That was on a Friday. On Sunday, we are seated with my husband, and I just started feeling like I'm cramping, and it's coming in intervals. And the moment I got to the hospital, I started bleeding, like seriously bleeding. What I was going through is something called placenta abruption. So because of how the BP was so bad, my uterus detached from the placenta, hence causing the bleeding. So I went in for an emergency C-section. By the time the baby was being removed, she had already flatlined. So they had to resuscitate her. But thank God she's alive, gave birth at 975 grams. And she turned 2 years in January this year. So right now she's like 2 years, 7 months. Yeah. So now again at 2 years, 2 months, I discovered again I'm 2 months pregnant, still on IUD after 2 years. But so far, so good. My pregnancy has been quite smooth compared to where I was in the previous pregnancies.
So moral of this story, contraception doesn't work for you.
It doesn't.
Okay, that's a story for another day. So when we talk about risk factors that Daktari touched on, is this something that you've seen in your family?
My mom actually had it with me. And she was even, by then they referred it as toxemia. Yeah.
It was pregnancy-induced toxemia.
Yes. Yeah. So she was actually even admitted for a month in hospital, still at the same hospital. And I was born prematurely and was 2 kgs. But she had pressure. But with the other pregnancies, because I have 2 more siblings, she didn't have the condition, but she had it with me.
All right then, so Daktari, she's touched on some of the symptoms that come with preeclampsia. Now, sometimes it comes without them. Explain.
As it's called a silent killer, most people don't have any symptoms. That's why every patient who comes to hospital has to have their blood pressure checked. And if it's elevated, that is above 140/90, which is the cutoff, we need to repeat it after at least 4 hours to confirm that the elevation was true and not just false. And if it's true, it's high, then we now start looking for those other features to suggest preeclampsia being there or being absent.
So if I cannot check my blood pressure wherever I'm at, what should I look out for?
Severe headaches that were not there before, change in your vision, so start having either blurring of vision or sensitivity to light. Some people start having difficulty in breathing because the lung tends to accumulate fluid. Some people start having the heart beating very fast because it's struggling to pump blood against narrowed vessels, which is the cause of the high blood pressure. Some people will come with pains on the upper abdomen, just below the rib cage on the right side. Some people will present with reduced urine output and even very severe abdominal pain, low abdominal pain like what she has due to a condition we call abruption, which is premature separation of the placenta. And even some just come with a general body swelling up, down.
Okay.
And of course, that's the milder form. If they come with a convulsion, now that's a serious one. We call it eclampsia.
Okay, and I mean, I'm thinking about the symptoms. Some of them are just typical pregnancy symptoms. Could that also be the reason why there's a lot of misdiagnosis around preeclampsia?
Yes, yeah. And that's why whenever you experience anything that was not there before, you've been okay, you start having difficulty in breathing, you go check. So there are those people who develop the blood pressure slowly over time, and there are those who just develop suddenly. So there's still people that we miss it because of how tricky the presentation is.
Okay. When we come back, we look at these complications that are associated with preeclampsia. Ashley already touched on some that she faced herself, and I'm sure you've had a couple of others in your own experience or from other people's experiences. We'll be right back. Welcome back to Health Diary. My name is Gladys Gashanja. The conversation today is preeclampsia. Helping us along with it, Dr. Felix Oindi, OBGYN at the Aga Khan University Hospital, and of course Ashley Muteti, who is a preeclampsia survivor, and she's also the executive director of the Zuri Nzilani Foundation. And before we went to break, Ashley, you had mentioned that the delivery of your first child actually ended up being the child had already passed on.
She passed on after 2 months being in hospital.
After 2 months in hospital.
Yeah.
So would you what did they classify that? Is it, Dr. What is considered?
No, that's a neonatal death.
It's a neonatal death.
Yes,
Eh? Okay, so at this point, what did they explain would be the issue why she didn't survive?
The condition that she had was a digestive kind of thing that affected her gut. So she died because of sepsis as a result of the condition.
But the second one survived.
The first baby I delivered at 30 weeks, the second baby 31 weeks. In fact, the second baby was way smaller than the first one because the first one was 1.2 kgs. This other one was not even a kg. Yeah. So I think it was just sheer miracle because I got to the hospital on time.
Okay, so Daktari, when you come to inducing labor, which I understand delivery is the best treatment for preeclampsia, when do you decide we can go ahead and birth this one, or this one can stay on longer?
Treatment is giving birth. So when you get somebody who has preeclampsia, the biggest challenge is when to have them delivered. So if somebody presents very early, at let's say 24 weeks, you have to create a very delicate balance between prolonging the pregnancy to attain viability of the baby versus by prolonging, increasing the risks to the mother, whereas we are not guaranteed of the good outcomes on the baby. Generally speaking, when we initiate the control measures, the treatments, and the blood pressure stabilizes, we can try push to 37 weeks. However, at any one point when the blood pressure is worsening, we'll deliver, even if it's at 28 weeks, even if it's at 30 weeks, because at that point, the health of the mother is at stake.
Okay, yes. Now most people, when they hear preeclampsia, they associate it with miscarriages. But there are more complications that come with preeclampsia. Which are they? So
the commonest complication of preeclampsia is actually prematurity. The other complications is like what she had, abruption, which means when the blood pressure rises so much, the blood vessels around the placenta can't sustain that very high pressures, so they break. The other complication could be eclampsia, which I said earlier, which means convulsions. Some people will have pulmonary edema, difficulty in breathing, and might even require to be hospitalized in an intensive care unit to support breathing. The disease also tends to affect virtually all systems in the body. Hardest hit is the kidneys and the liver. And of course, as I said earlier, it can be fatal, so to either side.
There must be a lot of stigma that comes with it.
Yeah. A lot of people think giving birth prematurely is as a result of you having abortions before. I've had women who've had to separate. Even when I was in hospital, there are women who actually separated with their husbands as a result of giving birth prematurely, having a sick child in hospital. You don't understand what's going on in your body looks different overnight, and then all these complications, the hospital bill, it's not cheap. I would say emotionally draining situations for a mother going through this particular condition.
Oh, wow. Now, Dr. when you decide that a mother can keep the pregnancy under, supervision, what is the treatment modality in that case?
The treatment modality first involves giving medication to mature the baby's lungs, because as much as you want to wait, the condition can change very suddenly and you need to deliver immediately. The second one is medications to control the blood pressure. Depending on what stage of the pregnancy, some will require doing ultrasound measurements once a week or twice a week, and some blood tests to just ensure the condition is not worsening. Yeah, so the care is individualized to the patient and the presentation.
Now, is it possible, Dr. to have had preeclampsia and not deal with hypertension after delivery?
So most of the pregnancy-induced hypertension actually resolves after pregnancy. What maybe I should have mentioned is that some preeclampsia can develop after delivery. So you find you are okay all through, you delivered normally at term, then when you went home within the first 6 weeks, you develop elevated blood pressure. So that is still considered preeclampsia and affects about 5% or less of women. So it's not as common as these other ones, but it can happen.
Okay, you've talked about extended stay in hospital. That must cost a lot.
It's a foot and an arm, to be honest.
How did you cope?
First of all, it's so emotionally draining to see such a small baby fight for their lives. Yeah, you're in a room where another mother, one day you're in the same room and she loses her baby in front of your eyes, and then you're like, probably my baby's next. So it's emotionally tormenting to be in that facility. Number two, it is expensive. The cost of having a baby in an incubator per day only is a lot of money. You've not counted the medication, you've not counted the doctor's visits and everything that is happening to the baby, the diapers, the everything, yeah. We did a lot of fundraising because the bill was around 6.9 million.
So are you fundraising because your insurance cover has been exhausted or there was none to start with?
The insurance will cover to a certain degree. So you top up the rest of the amount, which is a lot.
Okay, now, Daktari, a woman in Mashinani having issues with preeclampsia, will NHIF help?
Yes, it will. Actually, the Linda Mama program caters for delivery as a whole. The challenge is maybe they may not get access to the kind of care that she had. And that's one of the reasons why we say high blood pressure conditions in pregnancy are among the leading causes of maternal deaths worldwide after bleeding.
All right. Now, Ashley, first baby, second baby, now you're on the third, giving it an easier time, you would say. How have you kept yourself calm through the chaos?
In fact, on my way here, I was telling my friend, I think at this time is when I'm starting to enjoy my pregnancy because I was so tense. Even right now, I'm tense because you don't know what will happen. Right now, at the stage I am in right now is when things started going really bad. So, you know, you get so anxious about the what ifs. I wake up every morning, I check my legs, I check my hands, I check my feet. I check my pressure just to make sure everything is in order. So it's an emotional journey.
So you actually need a very supportive support system around you, for lack of a better word. Have somebody you can work closely with. If you can get a doctor, you can even call anytime, you can text. For those who have spouses, we encourage you to come together to hospital because then whenever you are going through something, there is your first line of defense. If you have a very close friend, the same thing. Opening up to somebody is good because then it will help allay some of those fears.
And speaking about sharing, what is the role and the impact of support groups for women who have this shared experience?
I think it's a very core and important element or thing to have. So we are in a group or a system where we share information, share contacts with doctors and where you're supposed to go to in case something happens to you. If a mother also wants to get pregnant again, what's the best step? Can we do preconception care before you get pregnant so that the doctor can clear you for having another baby? So it's a good area for support, emotional support, and also a very good platform for learning and just taking you through the journey. Because for me, I was in hospital and I was like, I felt alone because I felt like there's no one else who has gone through this condition. No one is understanding me. No one can tell me, probably, you know, I've been there and this is how it happens and you'll be fine. You know, I needed that assurance and someone just to talk to during that time.
Okay. Clearly, information is power, and we thank you for what you're doing with the foundation to help other mothers deal with the same. Well, Ashley Muteti, pre-eclampsia survivor, and also the Executive Director, Nzilani Foundation, and of course, Dr. Felix Owindi, who is an obstetrician gynecologist at the Aga Khan University Hospital. Thank you for joining us on this conversation. Time now for a health tip.
Brushing of the teeth is a very important aspect of making sure that you maintain your teeth. You should make sure that you have the right toothbrush. A good toothbrush should have medium bristles. The ideal time for brushing should be at least 2 minutes. You should brush your teeth at least 2 times daily, and the most important time for brushing is at night, because at night that's when the bacteria are most active, because you're not eating, you're not talking, you're not doing anything with your mouth. You should make sure that you brush all the sides of your teeth. You should make sure that you do circular motions on the back teeth and angulate your brush 45 degrees towards the gums. Horizontal motions like this are discouraged because it will cut across the gum and you'll have gum recession. Make sure that you brush your tongue because it can be a source of bad breath.
Thank you for joining us on Health Diary. That was quite an informative conversation on preeclampsia. For any of your questions, remember you can engage us on our social media handles. My name is Gladys Gashanja, and today we've been coming to you from the 4 Points by Sheraton here in Hurlingham. Until next time, see you. Health Diary. My name is Gladys Gashanda, and today we're coming to you from the 4 Points by Sheraton here in Hurlingham. Now,
oh, so si inakaa baya.
Nini mnafanya hivi? What is that?